Pediatricians in Nanaimo say sick and vulnerable children are being put at risk by administrators at Nanaimo Regional General Hospital. The doctors are voicing their concern over a policy that allows adult patients to use beds in the children's ward. They say children's health should be the top priority, but right now it doesn't seem to be. CTV's Scott Cunningham has that story.
Rattling away at her keyboard is Dr. Jane Pegg. The pediatrician isn't checking medical files, she's writing angry letters. Documents she hopes will incite change.
We're a big enough hospital and we function as a regional hospital for pediatric care, and we should have a protected space for children.
To protect Nanaimo's little ones, Dr. Pegg wrote this letter to the public. In it saying adult patients have been assigned to designated rooms in the pediatric ward, even admitting at times it's hard to tell the space is for sick children. Pegg says those beds might not always have a child in them, but adult patients in the area could infect already sick children with outside germs.
They need a protected space.
The pediatrician also says the Vancouver Island Health Authority misled her staff.
It was sold as a short-term solution to us, and here we are a year later with still this going on and no end in sight that we've been told.
Dr. Pegg is not alone. Several other Nanaimo pediatricians have come out voicing concern over unacceptable working conditions. The Vancouver Island Health Authority is simply saying they're doing everything they can in some of the busiest times they've ever faced. The Vancouver Island Health Authority says space is being used by adult patients because it has to be. Pressure on the hospital has been unusually high in the last year, and especially in the past few months. And VHA isn't willing to deliver care in hospital hallways, so open space is being snapped up.
We have to use all areas in the hospital to accommodate patients, particularly when we're in overcapacity situations. And we have no control over who gets sick and when.
While small patients may have to share space, health authorities say they are not sharing germs. Adult patients in the area are segregated and, according to officials, pose no health risk. Dr. Pegg, however, is not convinced.
That changes the space for the children. It's a less safe space for children.
Island health authorities are attempting to address the issue, creating an emergency discharge committee to move less sick patients out quickly. But for the group of concerned pediatricians, it's not soon enough. They want their space back now and hope the public will help them lobby VHA and the BC government to do it. Scott Cunningham, CTV News, Nanaimo.